This program is about personal care and bathing. After completing this lesson, you will be able to identify 2 infection control techniques to practice during personal care, explain 3 patient rights that apply to care delivery, identify 2 measures to maintain the patient's safety during a shower or tub bath, and describe the procedure for a complete bed bath.
Hello, I'm Dennis. Today, you're going to learn about how to help your patients with personal care, and I'm going to serve as your model patient. Would you believe it? Before my illness, I was up at the crack of dawn, run 4 miles, and hit the cold shower before breakfast kind of guy. Then my leg began to get numb and give out once in a while, and that's scary. And when I started seeing double, I decided to get a checkup, but then I felt fine for 6 months maybe. And my eyes still got blurry at times, but I chalked that up to long hours and eye strain. I was a reporter with daily deadlines. I did notice I was more tired than usual. And then one day at work, my legs began to feel like needles and pins were sticking in them. I tried to get up, and it felt like they weren't there. When I called to my friend, my speech was slurred. Well, I couldn't stand, I couldn't walk, I couldn't talk. I panicked. When I found out that I have multiple sclerosis, diagnosis hit me hard, but it was the changes that this illness caused in my life that hit me even harder. I mean, can you imagine what it's like to be totally self-sufficient one minute and then need someone to brush your teeth and give you a bath the next? I was deeply depressed. With the ups and downs of this illness, my life has been a roller coaster ride. But through it all, though, my home care team has been there for me, and with their steady support, I've adjusted. I work at home as a freelance writer, and I live a good life in spite of my limitations, and I appreciate life more deeply because of them. Well, I'll quit talking now and let you get on with the lesson. But Helen, my home health aide, and I will appear now and again to demonstrate personal care, to offer practical tips and patient insights.
Cleanliness is next to godliness. I know you've heard this truism before, probably as a child from your mother. And like most mothers, she probably used the admonition quite often to instill healthy habits. For at least a century, we've known that cleanliness promotes health. The methods we use to achieve cleanliness have changed through the years. We no longer have to pump water from the well, heat it on a wood stove, and bathe in galvanized wash tubs. Homemade soap is a relic, and vinegar, once a popular hair rinse, is now a salad staple. Yes, times have changed considerably. It's much easier to take a bath when there's indoor plumbing, and there's so many products available for personal care. Still, cleanliness remains the most important health habit to practice ourselves and to encourage in others. While I'm sure we've all learned the lessons well that our mothers have taught, we will review the basic principles of personal hygiene, beginning with a clear idea of what the word hygiene means. The dictionary defines hygiene as the science of health, its preservation, and the prevention of disease. It's also the practice of measures designed to attain and preserve health. Good personal hygiene habits and practices can help you preserve health and prevent disease. You may have children who you've taught to follow your good example, knowing it's the best way to keep them healthy. However, assisting with your patient's personal hygiene is quite another matter. There's a big difference between cleaning someone up and giving quality care. In this series, we'll demonstrate the personal hygiene measures that will help your patients look good, feel good, and resist disease through cleanliness and care of their skin, mouth, nails, everything from the hair on their heads to the toenails on their feet. Your goal is always to deliver quality personal care, whatever the circumstances. You face 4 challenges in achieving that goal. You must provide care that meets the patient's needs and is within the plan established by the physician and the nurse. While providing care, you must practice good infection control techniques and maintain the safety of everyone involved. And you must promote your patient's rights. Let's start with providing care that meets the patient's needs. When the patient is admitted to the home care program, a professional member of the home care team, usually a nurse, performs the initial assessment. During the visit, the nurse identifies and evaluates the patient's abilities, limitations, and needs. The nurse develops a plan for the patient that fits with the medical orders. If that plan includes home health aid services to assist the patient with personal care, the nurse will prepare an assignment. In order to direct the care you provide, these written instructions should identify and explain your responsibilities and duties, as well as those of the patient and any family member who participates in care. Remember these important points about your assignment. Review the assignment before you care for the patient. Know what duties and responsibilities you must perform. Organize your work. Think through what you must do, how you will do it, and how the patient will participate. Have all the supplies you need before you start. There's nothing more aggravating and potentially hazardous for your patient than realizing you don't have towels handy when the patient's halfway out of the tub. However, even as you organize your work to suit the needs and wishes of your patient, it's also your responsibility to complete the assignment during the time allotted for your visit. You may have many tasks to complete in a short period of time: preparing a meal, giving a bed bath, assisting with oral hygiene. If something happens repeatedly that interferes with timely completion of your duties, like the patient always has visitors at bath time, try to resolve the problem. You may need to discuss the matter with your nursing supervisor. Working as a team, your patient, the nurse, and you can solve the problems. Complete your responsibilities as assigned. That means you should do everything that is on the assignment. Not performing duties as assigned can create problems for your agency with reimbursement and at the time of survey. The reverse also holds true. There can be problems if you do tasks that you are not assigned to do. If your patient asks you to perform a service, such as trimming toenails, that is not on your assignment, check with the nurse. There may be some medical reasons why you cannot do this. Also, talk with the nurse about any problems you experience during care. Perhaps it's too difficult to transfer the patient into the tub, or the patient won't let you perform skin care. Observe your patient during care delivery. You have an excellent opportunity to observe tissue directly and notice any changes or impending problems while providing personal care. Your assignment should identify important things to watch for or observations to record. Your inspection should be unimposing but thorough. Signs may be obvious. Scratch marks on your patient's hand are easy to see. At other times, you may need to check more closely. For example, if a patient complains of a sore inside the mouth, you may need to use a flashlight to get a good look. Don't try to diagnose. Record your observations specifically, completely, and accurately. Report to the nurse significant findings, that is, those that concern you or the patient or that you believe need prompt attention. Your observations are invaluable to the care planning process and perhaps even to the treatment plan. Scratch marks could mean the patient's nails need attention more often. And the mouth sore you observed could be an early sign of disease, but more likely evidence of poor oral hygiene practices. Your conscientious inspection can mean early treatment. While providing care, you must practice good infection control techniques. I know you've heard it a million times, but it bears repeating. Hand washing is the single most effective means of controlling infection. Hand washing alone has saved countless lives by preventing the spread of diseases. Our hands are constantly in touch with contaminated surfaces. We must diligently protect ourselves, our patients, our families, and the community from infectious organisms by washing our hands in the right way at the right times. That includes when you arrive at a work site and before leaving. Before and after food handling, after blowing your nose, covering a sneeze or cough, combing your hair or using the bathroom, after handling soiled items, Before, after, and sometimes while in the process of performing or helping your patients with care, and any time you think you've had contact with infectious material. Ask your instructor for help if you need a review of the hand washing procedure. Universal precautions dictate that you treat all blood and bodily fluids as contaminated, so it may be necessary for you to wear protective, disposable gloves during some personal care procedures. Always wear gloves when you will have contact with blood or bodily fluids, or with materials or substances that contain or are soiled with blood. That means wear gloves during procedures like perineal care or oral hygiene, and when you handle utensils or linens which are soiled with bodily fluids. And remember to change gloves when you are moving from a dirtier procedure to a cleaner one. For example, before breakfast you assist the patient with a bedpan. Remove those gloves, wash your hands, and put on clean gloves before you help the patient with her dentures. Know how to put on and remove gloves. Put used gloves in a plastic bag that will be securely closed when discarded in a trash container. Wash your hands with soap and water after removing gloves. You do not need to wear gloves for contact with healthy, unbroken skin. You'll notice that Helen, the home health aide, does not wear gloves to give Dennis a back rub or foot care. That's because he has healthy skin with no sores or rashes. Good infection control practices also involve proper handling of soiled and contaminated materials. For linens that are soiled with bodily fluids, wear gloves and carry the linens away from you. Put soiled linens into a hamper or designated container for prompt laundering. Discard soiled dressings into a plastic or heavy paper bag for double bagging. Never throw linens or soiled dressings on the floor. Whether in your own home or someone else's home, put safety first. Here are some general measures to maintain safety. Provide good lighting. Keep floors and walkways dry, non-slippery, and free of clutter. Wipe up wet spots on the floor. Know how to use assistive and adaptive equipment, including canes, walkers, handrails, or grab bars. To avoid the risk of burns, set the hot water heater near the lowest temperature setting, typically 120 degrees Fahrenheit or 48.8 degrees centigrade. Always test water before exposing your patient to it. And remember to practice good body mechanics when moving the patient. And the last important challenge you face in providing personal care, promoting your patient's rights. Patients have the right to participate in planning their care, and it's crucial that they do so if they're able. Include your patient in decision-making and problem-solving. In order to direct care towards the patient's best interest and well-being, you must know and consider each patient's unique habits, likes, dislikes, even culture and religion. Involve the family members whenever possible. Often they share caregiving responsibilities as you work toward common goals on the patient's behalf. Their long-standing knowledge of the patient makes them an important contributor to planning appropriate care. Listen to and acknowledge their suggestions and opinions. Patients also have the right to participate in performing their care. It's very important to encourage and help your patients to do as much for themselves as they can do and are able to do safely, based on their doctor's orders and your assignment. With the right to participate in care delivery also comes the right to refuse care. Your patient may refuse certain care, sometimes with good reason. For example, a patient who is exhausted from therapy may refuse a needed bath. The problem may be a simple matter of timing. After a brief rest period, your patient will probably welcome a refreshing bath. When the patient refuses care, listen with understanding to identify the cause. Try to work out a solution so that both your patient needs and yours are satisfied. If for some reason you are unable to resolve the problem, chart the reason you did not provide care and discuss the matter with your nursing supervisor. The patient also has the right to respect of person and property. It's important to remember that you are a guest in the home. The patient and other family members control the home setting, so you need to work within that framework to accomplish goals. Adults, especially older adults, have their own way of doing things ingrained over the years. Their personal habits may not be as healthy as they could be, but they are habits, and habits are not easy to change. Respect begins with listening to the patient and communicating compassion and concern. Pay attention to their feelings and opinions, then work with your patient to achieve the goals of care. Showing respect for the patient's property during personal care means proper and careful handling. In performing personal care, you may have to go into drawers or closets. Ask the patient where equipment or supplies are before you go rummaging. Return supplies to the proper place and clean up after you're finished. Respect for the patient brings up issues of privacy and comfort. Everyone values privacy, especially during bathing. Plan for privacy, even when no one else is around. Close the doors or use screens or other barriers to gain privacy and assure that other individuals will not view or interrupt personal care. If others are present, ask them to leave the room during care. Close the curtains or shades if necessary. Comfort during care is also important. Patients are already weak and stressed by their illness and should not have to endure further stress during bathing and other activities. The physical environment should promote comfort. Room temperature should be 68 to 72 degrees Fahrenheit, 20 to 22.2 degrees centigrade, or slightly warmer for elderly individuals and children. Relative humidity is most comfortable between 40 and 60%. Good ventilation and air circulation or air conditioning also aid comfort, but avoid drafts. Arrange your routine for maximum comfort and ease. A patient with heart disease may need rest periods throughout care. You may need to delay a bath for a patient in pain until pain medication takes effect. Depending on the patient's particular circumstances, equipment, devices, and other materials may greatly enhance comfort. This includes special chairs, footstools, hospital-type beds, special mattresses and pillows, and others. If you believe a piece of equipment would greatly increase the comfort, function, safety, or well-being of your patient and it is not available in the home, talk with the nurse. Try special measures to make your patient more comfortable. Give a leisurely back rub or reposition and massage weary body parts to ease tension. A foot soak or soothing music may relax some patients. Others may enjoy reminiscing about the good old days. Simply listening with compassion and communicating a hopeful attitude may provide a tonic for many a mind and body. And before we move on to personal care procedures, we must look at the seemingly unlikely connection between comfort, personal care, and nutrition. Many of your patients are nutritionally at risk. That is, they do not eat a well-balanced diet, which is essential to maintain optimum health. A patient with poor oral hygiene practices may have a constant bad taste in his mouth. The incontinent patient lying in a wet bed is too uncomfortable to eat. You can see how attention to these personal care needs can contribute to your patient's improved nutrition. Let's take a few minutes to review some of the important points we've covered. What's the purpose of the home health aid assignment? Can you name 4 times when you should wash your hands? When should you wear gloves? Can you explain 2 measures to maintain your patient's safety during personal care? What are 3 of your patient's rights? In this series, we'll highlight personal care from head to toe, but not necessarily in that order. Even though you'll shampoo your patient while assisting with a shower, we'll save the procedural details until we talk later about hair care. And, because there is more to hygiene than applying soap and water, we'll talk about some of the products you can use. Just as no one routine fits everyone, so no personal care product will suit all patients. Without endorsing particular products, I will tell you about the purpose and qualities of some products. The information is simply a guide as to what's available so you can help your patient decide what is best for certain situations. your agency's policies and procedures, your assignments and input from your patient will guide you. Let's start our look at personal care by highlighting bathing. Will it be a tub bath or a shower? When is a partial bath acceptable or preferable? How often does your patient need a bath? The answer to all of these questions is, it depends. It depends on many of the factors we've already talked about, plus a few others. In planning care, the nurse will find out about the patient's usual personal routine before he or she became ill. The nurse will ask what the patient would prefer now, an early morning sponge bath or maybe a shower twice a week. The nurse will also evaluate the patient's bathing and hygiene needs. For elderly individuals and others whose skin tends to be dry already, frequent full baths are unnecessary and can be detrimental due to their drying nature. In these cases, the patient may need a complete bath only once or twice a week. On other days, a partial bath is sufficient. Patients who are incontinent, who perspire profusely, or who have special hygiene problems may require more complete baths more often. For a patient who is confined to a bed, a daily bed bath may be welcomed not only for reasons already mentioned, but because the patient enjoys your undivided attention, the stimulating conversation, the caring touch. Don't underestimate the psychological benefits of bathing. Some patients have no one to touch them anymore. An elderly patient who is widowed, whose children live far away, might go for months without a hug, even a handshake. You may be your patient's rare contact with the outside world. Try to make bath time as enjoyable as possible. Now you know the therapeutic and psychological values that come with bathing. A review of the procedures will help you provide care in the most pleasing and efficient manner. First, let's look at some of the products you may use. Soap removes dirt, dead skin, perspiration, and some microorganisms from the skin. Bar, gel, cream, whatever form, soap will get you clean. Read product labels. Ingredients like hexachlorophene or alcohol can rob the skin of natural moisture and oils and cause irritation. The antibacterial or antiseptic soaps, which actually kill or reduce the number of organisms on the skin, are not necessary unless disinfection is the goal. Use mild soaps. Soaps that contain cold cream or lotion both cleanse and moisturize. Use as little soap as necessary, especially on patients with sensitive or very dry skin. Always rinse well to remove soap residue. A deodorant masks and neutralizes body odors. An antiperspirant reduces the amount of perspiration produced. Typically, most antiperspirants contain ingredients that serve both purposes. Apply deodorants and antiperspirants to the axilla, the underarm area, after bathing. They do not take the place of bathing. Do not apply to irritated skin. Dennis is a patient who assumes responsibility for his own well-being. You can learn from him how to help all your patients.
You know many important things about helping your patient to bathe and shower, but I'd like to add a little about the burden of dependence. It's especially hard to have someone do personal care that you have managed your whole life. It's like regressing to babyhood, so don't feel bad if a patient seems to resent your help. It's just so hard to relinquish control. Let me just stress a few important points that could help. First, protect your patient's modesty. Work through a routine as to how and when to remove their clothes. I know I don't appreciate sitting around stark naked while an aide gets things together, so I undress in the bedroom and wear a robe. Next, let your patient have some control. I do what I can for myself, right down to using a soap on the rope so I don't have to ask someone to pick the soap up when I drop it. But I recognize that I need help, and I'm very grateful for the care I receive. You know, my morning routine is important to me. It reminds me of the morning runs I used to take, After 4 miles, I was exhausted, but exhilarated. And that's exactly how I feel when I get cleaned up. It's definitely worth the effort.
We're going to highlight 4 different types of bathing: shower, tub bath, bed bath, and partial bath. The nurse will plan care that is appropriate for your patient. Your assignment will direct you as to the type of bathing that is best for your patient. Dennis's ability to participate in personal hygiene activities can vary, depending on his symptoms and tolerance. The nurse decided that Dennis was able to direct the care that the home health aide provides. That means that he can decide the type of bath that he'd like to take. The home health aide assignment provides instruction for Helen. Dennis likes to shower every day, whenever possible, so we'll begin there. You can see that Dennis's bathroom is adapted for his special needs. Safety mats on the bottom of the tub and a non-skid bath mat on the floor in front of the tub prevent slipping. A towel does not stay in place as well. There's also a transfer tub bench, pivot disc, handheld shower spray, and an elevated toilet riser with rails. The equipment for your patient will depend on their needs and can include a shower stool, tub transfer board, lift, or more. Don't hesitate to call your nursing supervisor if you feel that your patient could benefit from adaptive equipment. Remember, your primary objective is safe and effective care. Helen arranges Dennis's clothes, washes her hands, and begins to gather supplies. She lays out 2 washcloths, putting one on the rack in the shower, 2 bath towels, a hand towel, soap, deodorant, shampoo, conditioner, lotion, brush, and comb. After Dennis is in the shower, she also uses a light cotton bath blanket to line the wheelchair. This helps dry him and prevent chilling. The room is warm and well lit. Helen closes the door to prevent a draft and assure privacy. Helen double checks to make sure Dennis has applied the wheel lock so his wheelchair won't move during transfer. Helen removes his slippers, places the pivot disc on the floor in front of his wheelchair, and Dennis puts his feet on it. She removes his robe, grabs the safety belt, and assists him to stand on the pivot disc, turn, and sit on the transfer bench. Helen helps him lift his legs over the side of the tub. She turns on the faucet, unhooks the handheld shower nozzle, and with the water aimed at the wall, adjusts the pressure and temperature. The water should be between 100 to 115 degrees Fahrenheit. Helen checks the temperature on the inside of her wrist to make sure it's not too hot. Dennis takes the shower spray and goes to work. If the patient does not have a handheld shower head, be prepared to get a little wet. You might want to wear protective attire. Helen pulls the curtain to assure privacy and lets Dennis shower by himself. However, she stays close by just in case there's an emergency. If your patient prefers that you leave the bathroom and it's safe for you to do so, make sure they have a bell or other signal device and that you are within hearing distance when they call. Do not lock the bathroom door. There's always the possibility that the patient will feel weak or lightheaded, especially if the patient is in bed much of the time. The bath or shower should last no longer than 10 or 15 minutes. Check your patient at least every 5 minutes and never leave a child alone. While in the shower, Helen helps Dennis to wash those areas he cannot reach and shampoos his hair. We'll talk about the shampoo in more detail later when we highlight hair care. When Dennis is thoroughly washed and rinsed, Helen helps Dennis dry off before transferring back into the wheelchair. Helen uses towels and a bath blanket to cover Dennis. She helps him dry areas that are still wet or damp. Dry skin thoroughly by patting it gently. Pay special attention to places where skin touches skin, such as under the arms, under the breasts, the scrotum, and between the toes. While you're bathing your patient, it's a good time to observe the patient's skin. Look for any reddened areas, particularly on pressure points like the head, ears, shoulder blades, elbows, hips, tailbone, knees, ankles, and heels. Report any important findings to the nurse. Helen will help Dennis put on his robe and they'll return to the bedroom for skin care, grooming, and dressing. We'll talk more about these personal care concerns in the next part of this series. Dennis chooses the clothes he will wear each day. Important for all patients because it encourages control over their lives. He purchases clothes that look good on him and are easy to put on, take off, and move around in. After your patient is settled, return to the bathroom to clean the tub, hang the towels and washcloths to dry, and return bath supplies to their proper place. Wash your hands when you've finished cleaning up the bathroom. Document care delivery following your agency's procedure. If your agency uses a flow sheet, check the appropriate boxes to identify what you did. Add any narrative comments. Record your patient's response or comments and any significant observations you made. Also chart any information reported to the nurse. Helen recorded that she applied lotion to arms and legs. She also noted that Dennis said he felt stronger today. On rare occasions, Dennis enjoys the relaxing effects of a tub bath, as I'm sure many of your patients do too. Always check your patient's assignment to make sure the patient is permitted to take a tub bath and note any special instructions that might apply. Your assignment may identify times that the patient may not have a tub bath. For example, the blood pressure is lower than the parameters on the assignment. Yet another patient may need his cast covered so it doesn't get wet. Know the best way to assist your patient with tub transfers. You must try to prevent falls. Transfers can be tricky, especially when getting a wet patient out of the tub. Do not attempt to do this unless you've been assigned to, and the nurse has determined that the patient can safely perform tub transfers. The type and amount of assistance depends on the patient. You may support him with a safety belt around the waist as he gets into the tub and slowly eases down into the water. Some patients can sit on the edge of the tub, use a bathtub grab bar for leverage, and with a little help, turn and lift their legs into the tub. Bath seats work well for patients who can't get down to sit into the bottom of the tub. Patients who are overweight or disabled may use a mechanical lift. Do not attempt to operate this device until you've been fully trained in its use. After you've read the assignment and you know what you will do, explain to the patient that you are going to prepare a tub bath, and then follow these general directions. Wash your hands before starting. Make sure the bathroom is warm and draft-free. You might need to turn up the thermostat until the bath is completed. Gather the necessary equipment. You may need a long-handled brush, bathing accessory tray, and hair care supplies if you plan to shampoo the patient's hair. Clean the tub if it needs cleaning and fill it half full with warm water. If you have a bath thermometer, the temperature should be about 105 degrees Fahrenheit. If not, test the temperature on the inside of your wrist to make sure it's not too hot. Assist as necessary during the bath, but encourage your patient to do what they are able to and allowed to do for themselves. Dennis's supplies are on a bathing accessory tray, so he is able to perform most of the bathing tasks without assistance. Your patient may prefer a basket at the side of the tub. Even patients who manage fairly well might appreciate help in washing hard-to-reach areas, such as their backs. Depending on the patient's situation, you may assist the patient out of the tub before draining the water, or you may decide to drain the water first. This way you can provide more support to the patient. Cover the patient with a bath blanket or towel while you drain the tub to prevent chilling. After assisting the patient out of the tub, follow the planned routine for drying, skin care, and dressing. Then return to the bathroom and clean the tub, hang towels and washcloths to dry. Return bath supplies to their proper place. Wash your hands when you've finished cleaning up the bathroom. There have only been a few times that Dennis has been too ill to get out of bed for personal care. On those days, he needs a bed bath. To give a bed bath, incorporate the important principles we just mentioned. Explain what you are going to do, wash your hands, provide privacy, and so forth. Adapt other steps to the individual circumstances. You'll need to pay more attention to organizing your work and supplies, as you typically will tend to bed making, oral hygiene, and hair care as part of a routine for a patient who remains in bed. As much as possible, arrange what you will need at the bedside before you begin, so you won't have to dash back and forth, disrupting both care and conversation. A smooth transition from one task to another will provide an atmosphere that demonstrates calm, competent caregiving. Follow these guidelines. Make sure that the room is warm. Close the windows to prevent a draft. Pay special attention to body mechanics to minimize the strain on your back. If the patient's bed is adjustable, raise the height. Cover the patient with a bath blanket or towel to provide privacy and warmth. Keep your patient covered as much as possible. As always, encourage patients to do what they can, even if their efforts are minimal. It may take more time and patience to hand them the washcloth and wait for them to wash their own face rather than do it for them, but it is a fundamental goal of care to allow patients to be as independent as possible. In addition to building self-confidence, the movement and exercise is beneficial, especially important for patients who are confined to bed. Work from cleaner to dirtier, beginning with the eyes, face, neck, and ears, and working downward to the far and near arm, the chest and abdomen, the far and near leg, and the feet. Notice how Helen places the towel under Dennis's arm and covers it. Then she shapes the washcloth into a mitt and applies just a bit of soap. She washes the arm, covers it, rinses the washcloth and then Dennis's arm, and dries the area. Use this same technique as you wash and dry each body part, one area at a time. After washing the feet, change the water. Then turn your patient to the side to finish the back. This is a good time to give a back rub, or you can wait until you've finished with perineal care. We've included back rubs in the skincare portion of this series. Wash the perineum last, as this is the dirtiest part of the body. The perineum includes the external genitalia and the anal area. The perineum should be washed at least once a day during the bath. Some patients need perineal care more often. For an example, after an episode of bowel or bladder incontinence. Keeping the area clean promotes comfort and a sense of cleanliness and helps prevent infection, odors, irritation, and skin breakdown. Your lesson plan includes a step-by-step procedure for perineal care for the male and female patient. Here are some hints to remember. Explain what you will do. You may need to use an acceptable term that your patient understands, such as private parts. Many people do not know what perineum, perineal area, or pericare refers to. Maintain privacy by draping a bath blanket over the patient. Always wear disposable gloves when performing perineal care and practice good hand washing technique. Use a minimum of mild soap and a soft cloth. The perineum is an extremely delicate area, easily irritated. When frequent washing is necessary, plain warm water or a no-rinse cleaner may be better. Following the rules of medical asepsis, work from the cleanest area to the dirtiest, the front to the back. Use a different section of cloth for each stroke. Rinse thoroughly to remove all soap and gently pat the area dry. You may apply a thin layer of powder if desired to aid comfort and absorb moisture. Skin should be thoroughly dry or the powder can cake and cause irritation. Observe for any strong odor, tenderness, lesions, swelling, or for signs of skin breakdown, irritation, infection, or discharge. If there's discharge, note the source, amount, color, and odor if present. Record your observations in specific terms and report to the nurse as necessary. Perineal care is an extremely personal and private procedure. Understandably, it is embarrassing and uncomfortable for patients to have someone else wash them, especially a person of the other sex. Be sensitive to their feelings and matter-of-fact in your care. If you engage them in an interesting conversation, it may divert their attention and ease their anxiety. For patients who can wash themselves, hold the blanket out of their way and guide and assist them as necessary. After you finish the bed bath, help your patient to put on clean clothing. Save cleanup and documentation until you've completed all care in the finest possible fashion and your patient is resting comfortably. In the beginning of this program, we mentioned that many patients do not need a daily complete bath. They may have dry skin or they may not tolerate a full bath procedure. If Dennis is fatigued or he has the flu, he takes a partial bath. A partial bath is the type of bath you may provide most often. It's almost like a half bath, tending to those areas that need daily attention: the face, hands, axilla or armpits, the perineum and feet, giving a back rub, and massaging lotion on skin. The patient may take a partial bath at the bedside or in the bathroom by the sink. Remember all the important principles we talked about: organization of your tasks and supplies, maintain privacy and safety, encourage the patient to assist, observe the patient's skin and performance, and document care. When providing a partial bath in bed, adapt the bed bath principles we just covered. Work from cleaner to dirtier in this order: face, hands, axilla, feet. Change the water to do the back and then the perineum. When Dennis takes a partial bath in the bathroom, Helen assists by running the water for him, making sure that it's the right temperature. She places the supplies he will use on the counter within easy reach as he sits in his wheelchair. She washes his feet in the foot basin, dries them thoroughly, and applies lotion. She helps him to stand at the sink to finish the perineal area. She finishes with a back rub and then assists him to dress. Finally, she documents care and observations. Time to check your learning. How do you decide what type of bath the patient should receive? What are some important safety concerns to remember when assisting the patient with a shower or tub bath? Can you list the order in which you bathe the patient for a complete bed bath? What is a partial bath? In this program, you've learned some fundamental principles for providing personal care and important tips on bathing your patients. By applying the information you've learned, you can make bath time one of the highlights of your patient's day.